Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update with data accurate as of May 11th, 2023. This week, I'm going to address a question that's on a lot of people's minds, which is what will be the impact of artificial intelligence on public health? Now, a lot of people are talking about AI in general, but I think it's worth us thinking about what the impact of AI will be on public health. And I think we have to recognize that there'll be both positive impacts and potentially negative impacts. In terms of the positive impact, obviously AI can play an important role in early prediction of disease through our behaviors, our internet searches, and so on. It will also help with precision medicine, understanding who we are as individuals and how we will likely respond to different medications. Obviously, it'll play a huge role in imaging, X-ray, CT scans, MRIs. I mean, you can read them very quickly. Things people don't think about a lot is drug discovery. Obviously, a lot of drug discovery goes on, but with AI, you can multiply the speed tremendously. You can look at this antibiotic works. What are some structures of it that will predict it? And also outbreak identification and management. Early on in an outbreak, you might see an increased number of people searching the internet for some particular field, or reduced motion, people staying home because they're sick, or fever. If you have an artificial intelligence network with big data and analysis, you can actually start identifying those behaviors and even things like excess mortality, excess hospitalizations before the rest of us would realize it. Obviously, health monitoring devices and availability of accurate health information. And then also in terms of developing and asking the questions that need to be answered in terms of research and policy planning. It can get past the politics and past any assumptions that we might have and say, here are some things we need to study. So clearly there'll be some positive impacts of AI, but also potentially some negative ones. Obviously, AI and artificial intelligence network can be no better than the data that's fed into it, and it could have bias and discrimination. And not just always in the way we think about it, but for example, if someone comes in with lung cancer and they're a smoker, we might assume, AI might assume that it's the lung cancer is from smoking, but it may be from radon exposure in the home, which then has implications for the other family members and so on. A big issue with AI, of course, is privacy and security concerns. What you hear a lot of people say is, I'm not sure I want people having all that information about me. But I think it's both a direct and an indirect concern. The direct concern is this computer network will have data about me. But even more importantly, on the indirect side, they can know a great deal about who I am, how I act, how I think, without actually necessarily knowing who I am. And I'm worried that will result in being able to target me with very specific ads, very specific political outreach, and so on. Obviously, AI can make mistakes, as can any intellectual network. And because there's a lack of transparency, you don't always know how that decision was made. We may not be able to correct that error. And that does raise some legal and ethical challenges. Who's responsible for the impact of AI? And then probably the concern that a lot of people have, along with security concerns, is workforce displacement. Will people lose their jobs because artificial intelligence can do what they do quicker, better, faster, more accurate, or so on? So in terms of the impact of AI on public health, I should point out, and probably obvious to many of you, that all the previous material was generated entirely by ChatGPT based on two simple prompts. What are the positive impacts of AI on public health, and what are the negative impacts? I didn't do any of this myself. I just had those questions plugged in. And frankly and honestly, it was probably a better and more accurate summary of the impact of AI on public health than I could have generated myself. And so that actually, as an educator, it raises some important questions for me, which is going forward in this era of the internet and in this era of AI, What should we reasonably expect of students in terms of knowledge acquisition and memorization? What should we reasonably expect of students in terms of how to express and communicate knowledge? And what should we reasonably expect of ourselves in terms of how we exchange information? The thing I'm worried about is that we may be holding on to paradigms from the past that are no longer relevant. You go back a couple of hundred years, there were all these skills that people had to have to be successful in life, but those may not exist anymore. We may be holding on to paradigms from the past. And I ask myself this question: have we changed how we educate as much as we've changed how we look in the professorial ranks? So I'm not at all sure that the real drive right now should be for all of us to ask ourselves, okay, this is a reality. We're not going to change the fact that AI exists. How does it inform how we teach public health and how we teach other fields as well? So there'll be huge impacts of AI on public health in terms of disease diagnosis, outbreak recognition, understanding how to change policy. But I think perhaps in the most fundamental level, it will drive us to rethink what it means to be an educated citizen in the 21st century. I'd like to thank, and by the way, please share these videos with anyone who might be interested. I'd like to thank Leah Loveday for conducting the Chat GPT searches in support of this update. And as always, thanking Dara Young for editing, producing, adding captions, and posting this video. If you have any questions, comments, concerns, recommendations about this discussion of AI or any other evolving public health issue, please let me know. I look forward to hearing from you. And until next week, please be well.